A few seconds of ignoring the signs of an asthma attack can turn the situation into a medical emergency. So let's quickly review the signs of an acute asthma exacerbation so you can recognize it immediately. First, an acute asthma attack occurs when the patient's airway becomes severely narrowed due to bronchoconstriction, increased mucus secretion, and a smooth muscle spasm. This means air has difficulty entering the lungs, and even more importantly, it cannot be properly exhaled. Now observe that our patient is breathing rapidly with shallow breaths, and their forehead is covered with sweat. Remember that tachypnea, dyspnea, and diaphoresis are early warning signs of respiratory distress. To help remember these symptoms, I placed a mask on Dr. Disney to make sure that you remember. If you think these points could one day help save a patient's life, like this post, and let's continue with the remaining signs. Now look at the patient's finger, showing 88% oxygen saturation, indicating hypoxemia. This patient may require immediate supplemental oxygen. Also look at the monitor beside the patient, showing a heart rate of 128 beats per minute, indicating tachycardia. The heart is trying to compensate for the reduced oxygen supply. Now you can see a stethoscope placed on the patient's chest. This is to remind you that by auscultating the lungs, you may hear wheezing, a common sign of airway obstruction. However, this is an important point. If you don't hear wheezing and the chest sounds completely silent, don't assume the patient is improving. This is a critical warning sign. A silent chest means airflow is severely reduced or absent, indicating a life-threatening asthma attack with minimal air movement into the lungs. Knowing these warning signs could one day make a life-saving difference. If you think others should know this, support us so more people can see it. Now let's move on to the final two important points. You can see the patient is using extreme effort to breathe, and the muscles of the neck become prominent during inspiration. This is another important sign. Use of accessory muscle to respiration. You may also notice intercostal and supraclavicular retractions, which occur when the skin between the ribs and above the clavicles put inward due to increased work of breathing. Finally, we have attached a capnograph to monitor the patient's end-tidal carbon dioxide level. If these patients become fatigued, they may develop hypercapnia, which indicates worsening ventilation and the progression toward respiratory failure. In severe cases, the patient may require endotracheal intubation and mechanical ventilation.